My name is Alfredo Quiñones Hinojosa. I'm the Mayo Professor of Neurosurgery at the Mayo Clinic in Florida. I have been working for over 18 years in the field of brain surgery. I get to see some of the most complex brain tumors that you can possibly imagine. And these are tumors that are considered many times to be inoperable. The way that I think about a diagnosis and a treatment plan is I look at the patient. I look at what the patient has. I don't just concentrate on the films. I don't just concentrate on the disease. I concentrate on the patient and I try to tailor my treatment to what the patient needs. The most important thing for me about my interaction with the patients is the fact that I consider to be a privilege, the fact that they allow me to take care of them every single day. And to me, that is a gift that I take very seriously and allows me to give them my best, not only as a surgeon, but also as a human being, and more importantly, as a physician that cares for them.
This is Dr. Alfredo Quiñones Hinojosa, or Dr. Q for short. Here you can see him removing a life-threatening brain tumor. At age 54, Dr. Q is still at the top of his game. Currently, he is the Mayo Clinic Professor and Chair of the Neurologic Surgery. He runs a basic science research lab at the Mayo Clinic in Jacksonville, Florida. Dr. Quiñones comes from humble beginnings, being born in Mexicali, Mexico, and starting work at the age of 5 in his father's gas station. His family's economic situation worsened when the business collapsed, and in 1987, young Alfredo headed north to the border.
One choice that I knew I had to make, and I hopped the fence. I jumped the fence. I climbed the fence between Mexico and the United States at age 19. My hands, the very same hands that now do brain surgery, right around that time, they had scars everywhere from pulling weeds. They were bloody.
He got a scholarship of the University of California in Berkeley and completed his bachelor's in psychology, graduating with the highest honors. He then went to receive his medical degree from Harvard Medical School.
To yourself, you know what? I don't belong here.
Yes, many times. But I think that that's also what has kept me on the top of my game. You know, back then when I was in medical school, I remember thinking, wow, I look at my classmates. As you know, you had some of them who trained at the best prep schools in the country, who came from the most distinguished families in the United States, from tradition of education. And there was me, who barely had an education, but I was eager to learn. And I always knew that I had something that others didn't have, and that was that fire in my belly that keeps me going. There is my girl right there.
A fire that still burns today. Now let's really get into Dr. Quiñones' work. His clinical focus includes surgical treatment of primary and metastatic brain tumors with emphasis in motor and speech mapping during surgery, surgical management of intramedullary spinal cord tumors and lesions with spine mapping, pituitary tumors and skull-based tumors using transsphenoidal, endonasal, and minimally invasive approaches, and providing personalized medicine to improve a patient's outcomes. As you can see, Dr. Quiñones treats a plethora of conditions regarding the brain. Next, I'm going to give you some insight into all of them. Acoustic neuroma is a non-cancerous and usually slow-growing tumor that develops on the main vesicular nerve leading from your inner ear to your brain. Branches of this nerve directly influence your balance and hearing, and pressure from the acoustic neuroma can cause hearing loss, ringing in your ear, and unsteadiness. Acoustic neuroma usually arises from the Schwann cells covering the nerve and grows slowly or not at all. Rarely it may grow rapidly and become large enough to press against the brain and interfere with vital functions. Many different types of brain tumors exist. Some brain tumors are non-cancerous, benign, and some brain tumors are cancerous, malignant. Brain tumors can begin in your brain, primarily in the brain tumors, or cancer can begin in other parts of your body and spread to your brain as secondary metastatic brain tumor. Brain metastasis occurs when the cancer cells spread from the original site of the brain. Any cancer can spread to the brain, but the types most likely to cause brain metastasis are lung, breast, colon, kidney, and melanoma cancers. Chondrosarcoma is a rare type of cancer that usually begins in the bones, but can sometimes occur in soft tissues near bones. Chondrosarcoma happens most often in the pelvis, hip, and shoulder. More rarely, it can happen in the bones or the spine. Most chromosomes grow slowly and may cause many signs of symptoms at first. Some rare types grow rapidly and have a higher risk of spreading other areas of the body, which can make these cancers difficult to treat. Chondrosarcoma treatments usually involve surgery. Other options may include radiation therapy and chemotherapy. Chordoma is a rare type of bone cancer that happens most often in bones of the spine or the skull. It most often forms where the skull sits on top of the spine, or at the bottom of the spine. Chordoma begins in the cells once made of a collection of cells in developing embryo that go on to become the disc of the spine. Most of these cells go away by the time you're born or soon after. But sometimes, very few times, the cells remain and rarely become cancers. Chordoma happens most often in adults between 40 and 60, though it can happen at any age. Ependymoma is a type of tumor that can form in the brain or the spinal cord. Ependymoma begins in the epidermal cells in the brain and the spinal cord that line the passageways where the fluid that nourishes your brain flows. Surgery is the primary treatment for ependymoma. For most aggressive tumors or for more tumors that can't be removed completely with surgery, additional treatments such as radiation therapy, chemotherapy may be recommended. Epilepsy is a central nervous system disorder in which the brain activity becomes abnormal, causing seizures or periods of unusual behavior, sensations, and sometimes loss of awareness. Anyone can develop an epilepsy. Epilepsy affects both males and females of all races, ethnic backgrounds, and ages. Glioma is a type of tumor that occurs in the brain and the spinal cord. Glioma begins in the gluey, supportive cells that surround the nerve cells that help function. 3 types of glial cells that produce tumors. Gliomas are classified according to the type of glial cell involved in the tumor, as well as the tumor's generic features, which can help predict how the human will behave over time and treatments most likely to work. A meningioma is a tumor that arises from the meninges, the members that surround the brain and the spinal cord. Although not technically a brain tumor, it is included in this category because it may compress or squeeze the adjacent brain, nerves, and vessels. Meningioma is the most common type of tumor that forms in the head. Most meningiomas grow very slowly, often over many years without causing symptoms, but sometimes their effects are nearby brain tissue, nerves, or vessels that cause serious disability. Because most meningiomas grow slowly, often without any significant signs of symptoms, they do not always require immediate treatment and may be monitored over time.
This project was very helpful to me. I learned a lot of new things about the human brain and the nervous system. I used this learning we used in previous lesson. It was very interesting to use the anatomy and physiology as a sort of social outlet instead of just a school thing. Anatomy terminology has also helped me a lot to locate all these diseases that could occur in the human body.